Hi everybody, welcome to Pharma Explora. Today, we're going to talk about one of the healthcare system models in detail, the Beveridge Model, a global inspiration for equitable healthcare. I would love to remind you that we have previously discussed what a healthcare system is and its objectives, and provided a brief overview of 4 basic health system models worldwide. You can watch those videos from the links given in the description. Let's dive in. The Beveridge Model, named after the influential British social reformer William Beveridge, stands as a landmark in healthcare history. He published a report in 1942 titled Social Insurance and Allied Services, and became interested in fixing social inequality while working at the Toynbee Hall Charity in East London. Beveridge realized that just giving money or help wasn't enough. He believed that only a well-thought-out government plan could make a real difference. When the war started, Beveridge began working in Whitehall. He was asked to lead an investigation into social services. He wanted to fight against what he called the 5 giants: idleness, ignorance, disease, squalor, and want. His plan for a comprehensive social program from birth to death, which included a free national health service, upset some politicians. But it resonated with the public and convinced Clement Attlee's Labour government to put these ideas into action. As a result, his idea led to the establishment of the National Health Service, NHS, in Great Britain in 1948. The model originated in the United Kingdom and has spread through many areas in Northern Europe and the world. Its core principle is universal healthcare funded through general taxation. In simple terms, everyone gets healthcare, and it's paid for through taxes that everyone contributes. Every citizen, regardless of income or health status, is entitled to essential healthcare services. The government manages and regulates the system, acting as the sole payer for healthcare services. Now, let's take a look at the key features and main pillars of the Beveridge Model. Universal coverage. Every citizen within the system, regardless of income, employment, or health status, is entitled to essential healthcare services. This idea of social responsibility ensures that everyone is treated fairly and prevents financial obstacles to accessing healthcare. For example, the United Kingdom's National Health Service follows this principle by providing all citizens with primary care, hospital services, and preventive measures against illnesses. Centralized funding. In the Beveridge Model, the main way they get money is through taxes that everyone pays. This makes everyone responsible for keeping the system running and reduces the need for private insurance. Using taxes helps cut down on paperwork and spreads the financial risk, making it more stable. Government management. In the Beveridge Model, the government takes charge of running and controlling the healthcare system. They decide how to use resources, set rules for services, and ensure everything runs smoothly. This centralized approach can enhance system performance and accountability, particularly when compared to fragmented systems. Now let's see a step-by-step breakdown of how the Beveridge Model works. This model consists of 6 main steps. Taxes fuel the system. The government collects taxes from individuals and businesses, just like it does for other public services like education or infrastructure. These taxes form the primary funding source for healthcare under this model. Single-payer centralization. The government acts as the sole payer for healthcare services. It's like a massive healthcare shopping account for the entire nation. This consolidation streamlines payment processes and strengthens bargaining power with healthcare providers. Universal coverage guarantee. Everyone within the system, regardless of income, employment status, or health condition, is entitled to essential healthcare services. This means no one gets left behind due to financial constraints or pre-existing health issues. Government as gatekeeper. The government takes charge of managing and regulating the healthcare system. It determines what services are covered, sets standards for quality, and negotiates prices with providers to control costs. In this system, the government is like the boss overseeing and organizing the healthcare system. They decide what services are included, set rules to make sure everything is good quality, and talk to healthcare providers to agree on prices and keep costs in check. Public providers as backbone. In this system, most healthcare services come from hospitals, clinics, and healthcare professionals that are either owned or funded by the government. This helps keep the quality of care the same for everyone and avoids the push for more profits, which can make healthcare more expensive in private systems. Access based on need, not ability to pay. In this system, when people need healthcare, they can go directly to public healthcare providers without having to pay money upfront or deal with insurance claims. This way, money doesn't stop anyone from getting the care they need, making sure everyone can get help when they need it. Now let's look at the strengths and good things about the Beveridge Model. Social justice and equity, financial security, and standardized quality and access are considered as main strengths of Beveridge Model. Social justice and equity. Universal coverage promotes healthcare as a right, not a privilege, and contributes to improved population health outcomes overall. Financial security. Public funding protects individuals from medical debt and financial burdens associated with illness. When the government pays for healthcare, people don't have to worry about going into debt or having money problems because of being sick. Standardized quality and access. Centralized management facilitates quality control and resource allocation based on population needs, potentially ensuring equal access to essential services. With one group, the government, in charge, they can make sure healthcare is good quality and that everyone has the same chance to get the services they need. This helps make sure everyone gets what they need. Now let's talk about the challenges and considerations to think about the Beveridge Model. Rising healthcare costs, limited choice, and political sustainability are considered as main challenges of Beveridge Model. Rising healthcare costs. As people get older and medical technology gets better, healthcare costs go up. This can make it hard for the Beveridge Model's public funding system to keep up. It might mean longer wait times for treatment, limits on services, or higher taxes. Limited choice and competition. Unlike systems where you can choose more, the Beveridge Model might give you fewer options, raising concerns about innovation and responsiveness to patient preferences. Political sustainability. The success of the Beveridge Model depends on the extent to which people are supporting the system and the government consistently providing funding for it. In overall, the Beveridge Model continues to inspire numerous healthcare systems around the world. Many countries look at the Beveridge Model for ideas on how to do healthcare. If you understand the Beveridge Model and how it works in different countries, you can be part of conversations about healthcare. You can talk about what might be good or bad and push for healthcare systems that are fair and good for everyone. In conclusion, the Beveridge Model, which promises healthcare for everyone paid for by the public, has made a big impact on healthcare history. If you found this video helpful, don't forget to give it a thumbs up and subscribe for more engaging content. Thanks for joining Pharma Explora today. Let's meet again with another interesting video.